Welcome to the 50 Shades of Pain podcast. My name is Dr. Danny Shapiro, and I'm a doctor of physical therapy. If you're in pain or had terrible medical experiences, I will be telling you why the medical system is broken and why you probably feel stuck within it. If you've ever left a doctor's office and thought, what was that? Is that it? Well, then this podcast is for you.
It's interesting. People always ask me, "Hey, I have shoulder pain. What can I do for the shoulder? What exercises? What stretches? Hey, I have low back pain. Hey, I have hip pain. What can I do for this issue? What stretch, exercise, etc." But nobody asks me what not to do. Right? It's kind of funny. Like, what do we want to know all the things that we got to do, but we don't want to know any of the things that we should avoid doing. Which brings me to a very, very, very important topic of what happens when we get injured, whether it's a traumatic injury, something like an ankle sprain or a muscle tear, a bone break, etc., or a non-traumatic pain when we wake up and it's where did this come from, this pain? And again, as long as it's nothing internal and it's of a musculoskeletal or neuromuscular origin, meaning, some kind of muscle pain, some kind of joint immobility, it's causing this pain, whatever it is, right? No internal factors, no tumors, nothing like that, no heart conditions. There's a few things that we have to make sure that we don't forget to do, right? So, regardless of the injury, we have to keep moving. Most people think, okay, I'm injured, there's pain, we have to cut all activity, we have to, rest up, elevate, ice, heat, all of these other passive modalities, and just stop moving, whatever it is that is hurting or that's in pain. This is actually the opposite, the complete opposite of what we want to be doing. Um, Activity is actually very, very important. Making sure that we move and stay moving through an injury is very important. Now, is that movement perhaps minimized? Sure. Are we going to be jumping and running around if our knee hurts? Probably not. But is it a good idea to keep straightening and bending, loading it to tolerance? Oh, yes. Yes, it is. That is a very good, juicy idea that we need to entertain, that all the movement that we do should be to tolerance. Now, there's also kind of starts a lot of problems for me, when because I get kind of annoyed and angry, not at my patients or not at the people who stop moving, but I'm more angry at the doctors who tell people who are in pain to stop moving. Now, at face value, you may think, okay, that's actually pretty good advice, right? It's pretty good advice to probably stop moving. Um, Again, but it's not, right? We want to minimize the movement, which is very, very, very different. But doctors don't make that distinction. Doctors typically tell, okay, you have knee pain, just stop squatting, stop moving. And which is a very also irrational advice, by the way. If someone has knee pain and you tell them to stop squatting, um, how? Every time we go to the bathroom, we squat. Every time we sit down at the couch, we squat. Every time we sit behind the dinner table, we squat. Unless we're falling flat from a standing position to get down on the floor, down on the bed, or whatever it is, or unless we're standing and eating, unless we're standing and sleeping, we are squatting. So there's some version or another. It is a squat. Um, when people have low back pain, people are told to, oh no, don't you ever bend down. Don't you ever bend forward. Don't you ever bend backwards. Don't you twist your spine. That is the worst thing you can do. The hell it is. That's the biggest, biggest load of BS that has ever existed. And it's actually, I consider that outdated, old medicine. That is not current, should not be current advice. If your doctor is giving you that advice, please disregard, go see a physical therapist and a good one at that, please. But that is not what you should be doing, because that is only going to support and continue, kind of make the pain continue to fester and actually get worse. Our body is designed to move. First and foremost, our body, we are designed to move. We are movement creatures. We're not designed to sit still, stand still. Like, we're designed to push, pull, lift heavy things, push things. We're designed to do these things. All of our joints have a very large amount of force that it can tolerate, uh, before anything bad happens. Usually when injuries happen, especially traumatic ones, that means that you've exceeded the force that this joint, muscle, bone structure is able to kind of withhold. You go beyond that force and boom, the injury happens. Uh, But again, most people, it's kind of hard to get there. And if you have pain from a non-traumatic side, again, then there's some kind of inefficiency in movement, inefficiency in mobility, strength, stability. And that's what we have to find. Right. So when we have pain, the thing, again, and as a chronic pain specialist, this is what I see all the time. When someone is in pain and they eliminate movement, that will only make that pain worse. We need to find, how do we regress the movement that is going to be the most beneficial. If we regress it, if we have movement X, we can't do movement X. Okay, let's do half of movement X, right? So if we can't do a full 90-degree squat, okay, let's work through a quarter squat. Let's work through another range of motion that offloads the body weight that we have during a squat. What do we need to change to our body to make it more efficient, stronger, and then and as less of a provocative way as possible? How do we change the current state that your body is in? If we can't figure that out, we're going to stay. I had a guy who had 25 years of low back pain come into my office, and he couldn't bend forward. He could not bend forward. Bending forward was an impossibility. And you have to understand that he can't bend forward because he just hasn't been shown how to bend forward, or hasn't been shown how to offload the pain so he can bend forward. And that's exactly within 20, 30 minutes. That's exactly what we did within the first session. And he bent down, he bent forward for the first time in years, because we took the motion, took 5 or 6 steps back, warmed up the body, introduced new ranges of motion to the spine, and then he was able to reach down and his back pain was not a problem. Yeah, in fact, he hardly felt anything. Whereas before, yeah, this was an impossibility. And that's his words. His words were, this is an impossible task. I cannot do this. I haven't done this in years. We did it in 20, 30 minutes. And again, this is not some kind of magic. This is not a magical pill, not a magical injection, not a magical anything. This is understanding how the body works and helping to optimize it through healthy, non-provocative or little provocative movement. And this is the biggest problem in healthcare, right? There's no actual interest or time, which is a very big problem. There's no interest or time in the provider being able to actually help the person that's from them. For the most part, it's very hard to find a good doctor. I can count on probably one hand in New York State how many good providers there are. And maybe that's ignorance on my side, because I don't go out looking for them. That's going to take ages and years and years and years to find good ones. But I can list off maybe on one, maybe two hands, how many good quality doctors or providers or PTs or chiros there are in New York State, which is quite a big problem if you ask me. And what makes or breaks for me a good provider is one that is interested in the patient's story, right? This is the provider's interested in what the patient is actually telling them, truly taking everything that they say into account, right? What are the problems? What are the false kind of beliefs that this patient has because of their pain, which is, again, normal fake. This is not, false beliefs are normal, right? If someone has no experience in the medical field and they get injured, they're going to have a certain set of beliefs based on culture, based on a lot of different things, outside, inside input from their family and friends about what their pain could be, a lot of fear, anxiety, all those things. But there's a lot of false beliefs that need to be broken down, right? For example, the kind of the no push to move when something hurts. That's a false belief that needs to be changed to, okay, we need to move, but how can we move in a way that's not super provocative? Right? So this is an example of a false belief. So to me, again, the provider is someone who breaks through the false beliefs, who is interested in the actual story of the patient, and who actually spends the time to understand, okay, what is this person's current baseline? Regardless of the injury, regardless of the pain, regardless of the issue, what is the baseline of this patient? Because from there, if we know and understand the actual baseline, where's the patient starting from? What are their pain points? What can they do? Just as important as what they can't do, what can they actually do? And this is also kind of outside of the medical input, right? Like when a patient comes to see me, let's say it's something like shoulder pain, or somebody comes in with shoulder pain. I'm interested to see, what can this patient do without injecting any of my own bias to movement? What can this patient objectively do, and how do they subjectively feel, right? What can they physically do and how do they feel as they do it? That to me is the most important thing. Then I ask them to get more specific, right? And then we try to, really figure out, okay, if their shoulder hurts in this range of motion, what is the cause? What is happening internally? What is happening in the joint, the muscles? What's going on in the tissue that is contributing to the pain, or not? But again, it's this understanding of what the patient's needs are, what their issues are. This is what is a good healthcare provider. I don't care if it's from the PT side, the chiro side, the PCP side. The PCP's job for physical pain is very, very limited. That's not their job to help you with physical pain. Their job, well, at least the way it seems, is to cover up the symptoms. But a good PCP to me, in my mind, is okay. They can provide you options for drugs. But what is the most important thing is that they provide you a solid option or a referral system to people who are the appropriate providers, whether it's musculoskeletal or neuromuscular pain. So, if it's a referral to a good physical therapist, or if it's a referral to a good chiropractor, or if it's a referral to a good rheumatologist, neurologist, etc. Right? What are the next steps? It's about outlining the plan of, okay, this is where we are, whether you do an imaging or not. This is where we are. Where do we go from here? Right? Not just going all the way right away to doomsday and kind of like scenarios and scaring the patient beyond belief, which is a lot of times how patients come to me, is they're terrified. They barely come into my office because they're scared of another doctor's visit where they're going to tell them, okay, well, we can't help you, or this is the problem, or like, you gotta consider injections, drugs, or surgery. They're scared to hear that again, which is again, totally understandable. But that's because there's a lack of time and a lack of interest, like I said, from the medical provider side. And that makes the patient experience just that much worse. And when the lazy approach or lazy advice from the doctor to stop moving when there's a pain, that's the last thing they need to do is stop moving. They just need to find a more regressed form of movement. And that would literally solve so many problems. I cannot tell you. It's crazy. It is actually crazy. The amount of times someone has come in with terrible pain and we start just injecting little bits of specialized, specific movement for this patient. And suddenly pain drops by dozens of percent, 25%, 70%, 80%. Again, these are all subjective numbers that patients have said. It's not objective from my end because I will never know how the patient feels unless they tell me. But from even just one session, sometimes there's complete 90 to 100% turnarounds within the session. All the person needed was smart, targeted, specific movement. And that's it. The doors of progress flew wide open. And it's as simple as that. I've seen some very, very complex cases, very, very complex cases. People who have very hard times moving. I worked with this woman who, she dropped $50 on the floor. She just lost $50 because she was in so much pain. She could not bend down to the floor to reach it. If money depended on it, she just couldn't do it. And when she first sat down at my table, I threw my keys maybe a foot and a half away from her, and there was no shot of her getting it without a giant jolt of pain throughout her entire body. And she went from that to running, to lifting, to bending very quickly, considering how long that she's been in multiple car accidents. Pain was so bad as it was affecting her memory. And again, she went from that to running, lifting, squatting, moving, bending, all because, again, we regressed the movement and saw, okay, what is the most appropriate thing to do right now? A lot of people don't know this, but whether we're dealing with nerve pain, muscular pain, especially for someone with chronic pain, when we're talking about chronic pain has been around longer than 3 to 6 months. A lot of times there's some kind of nervous system involvement, whether it's neural tension, nerve symptoms. There's a lot of different things that, this is a whole other separate podcast episode. But a lot of times people don't understand that there's nerve and muscular involvement just because of the duration of pain existence. Body starts to compensate, more pressure on the nervous system can happen, and a lot of things can kind of escalate from there. But a lot of people don't understand that movement, especially mobility and range of motion, beginning, depending whether it's shoulder pain, low back pain, upper back pain, doesn't really matter. But movement and mobility can drastically change your nervous system response and your muscular response to maybe movements that you thought again were impossibilities or that you just couldn't do. And that's just because your body it just starts to wake up in a way, right? It's like, oh, okay, we're moving. Oh, I remember what this was like. Yeah, yeah, okay, let's open this up. Let's open that up. And again, before you know it, your body's moving better. Maybe not 100% right away, but it's better. And the better is what we're after. But again, it's like this all goes back to what we first started with. We cannot move forward if movement is eliminated. Period. That's it. Movement is everything. Um, Motion is lotion and brings all the commotion. This is a phrase that I love to say. It sounds ridiculous, sounds crazy, it doesn't matter, but it's true. Motion is lotion. Okay, and this is also anecdotal. Like, first of all, movement is backed up by research. Like, we need progressive movement. But even anecdotally, I've been injured myself. And every injury that I've ever had, I lead a very, very active lifestyle. Very active. I was a professional dancer for 16 years and I'm a bodybuilder. I just finished climbing Kilimanjaro. Like now I'm preparing for a half marathon. It's all injuries that happen along the journey of someone who's active. And even if you're not active, you still get it. Like things happen. It's okay. Well, we'll always find a way forward. But through every injury that I've ever had, movement has always been the answer. Always. From the first really bad injury that I got about 8 years ago, it was a disc herniation injury. My entire right leg was useless. I went to physical therapy. That was a whole load of nonsense. I paid a few $1,000s to a chiropractor. That was absolutely horrendous. They did nothing for me. I hobbled in, limped in, incredible pain coming in, incredible pain coming out. Even, after weeks of sessions, it did nothing for me. And what ended up working for me was me treating myself and incorporating movement, right? Super regressed because I was in a really bad shape. I was in a really bad place, but movement nonetheless. Movement is essential. It is absolutely necessary. And without it, we're not going to progress. We're not going to get better. So look, all in all, the main point of this episode truly was to highlight the importance of not eliminating movement when you're in pain. We have to find ways to continue moving in a tolerable, non-provocative way. And that is the secret, at least one of the biggest secrets that you must incorporate into your life to get you better. Now, again, everyone's situations are a little bit different. But as it pertains to musculoskeletal or neuromuscular pain, movement is a must. So I hope you guys enjoyed this episode. Again, there's a lot of things that I will be diving deeper into. If you did enjoy this episode, if this was helpful, if this opened your eyes to something that you didn't think was true, but it's true now, which I hope it is. If you enjoyed this podcast episode, please consider sharing this with friends, with family. Give me a follow. I would love to spread my message and to help spread good quality information to as many people as possible, because I truly do think people need it. People need a good source of information. People need a good source of positivity. People need a good source of, especially medical knowledge, that will help them in any circumstance. Or if they know someone who in their family is suffering, and this could be something that's life changing. I've already, even just from the last episode that I've done with this, I've already gotten messages saying, wow, this completely changed. This gave me the courage to speak up to my PT and change the way that we're doing things, or ask for another PT. And that PT was the one who helped me. And this is all I want to do. I want to create change. I want to create nice, healthy habits for people. I want to change the world, and I want you to help. So again, if you thought this was helpful, please, give me a follow on here and even give me a review on Spotify. I didn't know that was a thing, but apparently it is. And more importantly, just share with your friends and family so we can get the message out there and get rid of all this bad information. Thank you for being here. Much love to you all.